skin problems. And I'm just taking one type of skin disease that we're going to talk about today. And what makes skin problems interesting is that there's a lot of workers out there who have rashes. And most times they don't do anything about it. The only rashes that we tend to see are those which are debilitating, and rashes can be very debilitating. People who have severe rashes on their hands are very conscious, because what happens is you go out in the public, you meet somebody, you shake hands, and often they don't want to shake hands. People will ask them, well, you know, can I catch this? So it's a very debilitating disease. Of all the claims for occupational diseases, this is not injuries, but diseases, skin diseases make up a third of them. Underreported, there's delay in presentation, often for medical treatment because you think it's going to go away, and it produces long-term disability. What we want to do is to really identify it early enough, get the person out of the exposure early enough that it doesn't become a chronic problem. Again, talking about occupational illnesses, this was a survey in 1999 and it was 12%. Repetitive trauma was 66%. High-risk industry. What we deal with here in southwestern Ontario, machine tool operators, coolants. We already talked about the metalworking fluids. Plastics manufacturing. We have a lot of plastics plants. Food processing, especially out in the county. We don't do a heck of a lot of leather tanning and processing other than in the trim plants where they'll be utilizing leather for the automotive seats. We have a large agricultural industry, metal plating and cleaning, construction, printing. We don't do forest products. We have very few trees around. That's the only thing that we aren't having a lot of exposure. The skin organ. The skin is exposed to everything. Our whole environment, our skin is exposed to. There's many different layers of the skin. There's the very top layer, which is called the epidermis, and the lower layer, which is called the dermis, and you've got the subcutaneous tissue. Part of that or all of that can be involved. And through this, you can see the hair follicles, and I showed you a picture of folliculitis before where there was inflammation of the hair follicles. Oops. Contact dermatitis is what I'm going to talk about today. It's the most common of all of these skin problems, 90%, and it occurs obviously at the site of contact. So wherever the skin is exposed to a substance is where you're going to get the rash. Because of most activities, we use our hands. The hands are the area which most of the rashes occur in. And there is irritant, which I'll talk about, and allergic dermatitis, acute versus chronic. Irritant. Anything can become an irritant if you're exposed to it long enough. And in essence, what it means is that you aren't having an allergic reaction, but it's irritating to the skin, it produces a rash. There's some which are absolute irritants. If you're exposed to an acid, if you put your hands into hydrochloric acid, yes, you'll get burns immediately. If you put it into very strong alkalis, again, you're going to have a reaction immediately. And some are marginal irritants and repeat exposure. Water, who would think? If you wash your hands quite frequently or your hands are in water all the time, what happens is that it affects the fatty layer of the protective area of the skin, and you actually can get rashes related to it. Skin cleaners, industrial cleaning agents, oils, solvents over a long period of time, even plants and animal products will cause an irritant type of reaction. This is a picture of strong alkali exposure, and you can see these big, huge bubbles on the fingers where the exposure was. Irritant dermatitis. Again, this is along a belt line of where the exposure was. You get large blister areas, marked redness of the skin, and these raised blisters. This is related to ethylene oxide, and you see the blisters of the skin where the exposure was. This is a chronic one to solvents. Look how the skin has become very thickened, irritated. I mean, this person is going to have a hard time out in public because of the changes of the skin. You can imagine some of them will have pain, you get cracking, so they have pain, swollen, irritated hands, marked disability related to that. When something is airborne or not, often the person will present with rash around the eyes and the eyelids. That's where it becomes affected, and they'll present with redness of the eyes, irritation. And that gives us an idea that something is in the air that they're reacting to. Allergic one is actually where you become sensitized to the product and actually develop an allergy. And part of the problem when you become allergic to something is that once you're sensitized, even small amounts can produce the symptoms. So in essence, you have to totally get away from the exposure. And just quickly going through these, and it's in your handouts as to what type of exposures and what type of industries. And again, we actually see a fair number related to rubber accelerators at the clinic. Also pharmaceuticals, penicillins, glutaraldehydes, those making up capsules are in contact with a number of medications. So what do we do? So a person presents with a history of a rash. Well, number one, we take an exposure history. What are they being affected to? Are there other workers who are being exposed? We do the MSDS sheet to see if there's anything in there which is an allergen or sensitizer. We may send them for allergy assessment, and they will do something called patch testing, where they put drops of the different types of chemicals on the skin. And we assess after 72 hours. We often would like to do a work site visit to actually see what is going on. Are there other workers who have similar symptoms? Is it more of a factory-wide problem? Can this person be accommodated? Now, if it's an irritant, there's a number of things that you can do. You can change the process, reduce the amount of exposure that they've got. But if it's actually an allergy type of problem, often the only solution is taking the worker out of the workplace. So what we will initially do is a trial away from work. Will the rash improve? If the rash doesn't improve, does not necessarily mean that it's not work-related. If the rash has gone into the chronic phase, it can be a lifelong problem with the rash. And long-term solutions.